Well, we talk about changes in Medicare. There's one important aspect that affects senior health care, but is not covered in the Medicare program. We're talking about non-medical in-home care that provides caretakers to help senior citizens with just their daily life so they can remain in their homes. With me now with more on what this means is Roni Mayben, the owner of Heritage Senior Care. Roni, thanks for being here.
Thank you.
We've been talking about Medicare. We understand you get something happens, you get injured or you get sick, you go to the hospital, it gets taken care of, the government helps you. But at some point in your life, you get too old to take care of yourself. You're not really sick, but you can't take care of yourself. Why doesn't the government help us with that? Can't answer that question, can you?
No idea.
But the truth is that it does not. And what is non-medical in-home care? How do you describe that?
You did a pretty good job. Non-medical in-home care is doing those supportive services that if you had a family member in your home, maybe they could do them for you.
Simple things, isn't it?
Simple things: bathing, dressing, brushing your teeth, helping somebody get up, get down, help them in and out of the shower or the bathtub, maybe reaching parts of the body they can't wash, doing grocery shopping, meal preparation, vacuuming, taking them to get their prescriptions filled, even walking the dog, things
Does
like that.
Medicare cover any of that?
No, they don't.
Nothing.
They don't. What Medicare does cover is medically necessary, temporary, and intermittent home health.
Oh, you got to help me with that one.
So let's say, for example, you were to break your hip and you've gone through your rehab and everything, you come home. Medicare may cover a physical therapist in your home for a period of time. They may cover a bathing nurse, a registered nurse, a social worker. But those are people that come in and out of your home maybe once or twice a week, and they only last for a period of time and they're gone. But they're not doing your cleaning and your shopping and your cooking and changing your linens and those types of things.
One of the reasons we're bringing this up during this program about Medicare is that it's great to talk about how we have the government to help us with that, but not with this.
Right.
How do you then, as a senior citizen or a loved one of a senior citizen, how do you set it up so that you can protect yourselves? You can get this kind of thing taken care of, and maybe some help for it. How do you do that?
Well, one of the things that the government hasn't done is license non-medical home care providers too. So you really are, out there in this environment where there's nobody regulating these companies that are providing this.
We've had cases here in San Diego where home caretakers have taken advantage of people too, haven't they? And I'm sure you've heard some
they've been all over the
stories.
news and newspapers lately.
Exactly.
And most of those instances are happening from privately hired caregivers. They're not typically through full-service companies. There are 2 organizations that are certifying non-medical home care companies. And in San Diego County, in the Southern California region, we have the American Board of Home Care, and they have vetted these companies to prove that we are at least the employer of the caregiver. Then there's KUSI, which is the California State Association for Health Services at Home, and they have a certification program for non-medical home care companies. And they have verified that we are the employer, that we do TB testing, they've seen our service agreement, there's certain steps we have to go through.
Are there different levels of home, I assume there are, of home care depending on the patient or the client as to what they need and I suppose how you choose who goes in and takes care of these people, right?
Yes, definitely. You have to have someone that's qualified to meet the needs of that person's needs.
Sometimes it's physical, because sometimes they need to be lifted up into a chair, and sometimes it's I would think emotional or psychological, isn't it?
It is. Very much so sometimes. Sometimes it's just strictly companionship, just if somebody's not living in a household alone,
Do you think, and I'm asking just your opinion, do you think that we should fold this kind of service into some kind of, whether it be state or federal government program, or do you think it's better off taken care of in the private sector? Or maybe by insurance companies?
Well, we have a combination of the 2 right now, because we do have people on the county services, and I have a contract with the county, and so we do have some county-paid programs that are paying for minimal care. We do have the in-home support services program through the county as well. I feel government should be left out of what we're doing because I know what I'm doing now and we're doing a good job doing it. So I've been in this industry for 30 years.
What about insurance companies? This is all the part of the debate about the Affordable Care Act as to whether insurance companies should be more regulated. Can insurance companies get into your end of the business, or should they?
Well, they are involved in long-term care insurance, and that is an insurance you can purchase in your younger years when you're healthy, and it's quite expensive, but it's very worth it in the end when you need the long-term care
Okay,
coverage,
so we know Medicare doesn't cover this. We know that there may be some programs that can help you with in-home care, but we've got about 45 seconds left, and I want you to tell the people who are watching today, they understand now about Medicare a little bit more. How can they get more information? Where do they go to find more information about this, whether it's for themselves or whether for a family member?
I would direct you to our website, which is heritageseniorcare.com. I will have information on there regarding the 2 certification programs. If you're looking for a non-medical in-home care provider, if you go with a certified company, you're guaranteed to have protections there. If you go with a registry, and about 75% of the 400 companies in San Diego County are not employers of their people, then you're really left with a lot of risk at your hands, and people need to know the difference of that.
It is medical care and non-medical in-home care is such a confusing thing for so many families. Hopefully this morning here on San Diego people have started to understand, and certainly I hope they head to your website and get some more information. I suppose they could just ask for you directly too. I'm sure Roni would be happy to help them.
They can call us as well, and they can look us up on Facebook as well.
Great.
Too, so.
All right, Roni Mayben, the owner of Heritage Senior Care, thanks for being with us.
Thank you very much.
Appreciate it very much. All right, that's it for this morning's edition.